Hi everyone, my name is Dr. Pourdavoud and I'm a general pediatrician with Bliss Health System, and I also work in Calabasas Pediatrics. I'm here to talk to you a little bit about keeping you and your child safe in this COVID-19 pandemic. So a couple of things that I wanted to touch base on are what kind of symptoms to look out for. Things like fever, runny nose, congestion, coughing, also vomiting. So traditionally, we thought that maybe just with the fever that your child would have a more likelihood of having COVID-19, but even though our cases overall are going down, we are seeing some kids coming in with just a runny nose or a sore throat. Oftentimes it'll start with that scratchy sore throat and we'll see them test positive for COVID. And in the last couple of weeks, we've also seen some vomiting and diarrhea as well, and kids have turned out testing positive for COVID. So if your child is showing any of these symptoms or is also feeling tired or sick, then it would be a good idea to talk to your pediatrician or local pharmacy and arrange for your child to get tested. So what kind of test should you choose if your child is showing some symptoms of COVID-19? So currently there are rapid antigen tests. So those are the fast tests that usually you'll get results back within 15 minutes. And then there are the COVID PCR tests that oftentimes will need to go to a laboratory to get confirmation of COVID-19. So if your child is showing symptoms, it's okay to start with either one of those tests. However, if you do a rapid antigen test and it comes back negative and your child is still showing some significant symptoms, then it might be a good idea to repeat that test on the subsequent day or a day after. There also are home antigen tests that you can use as well, but make sure to talk to your child's school because certain schools may need you to go to your pediatrician's office to get documentation of that test result. One recommendation I do have is that if your child tests positive on the PCR test, that PCR test may stay positive for up to 3 months or 90 days after that initial positive. So if you're using testing to determine when your child can go back to school, which we'll touch base on in just a second, then we recommend the rapid antigen test, which is in a sense can detect your child's viral load and how contagious they are in that moment. So if your child tests positive for COVID-19, day 0 is the day that they first started getting symptoms, or if it was a screening test and your child never had symptoms to begin with, then day 0 is the day of your positive test. And then day 1 is your subsequent day. So if your child tests positive for COVID-19, they will need to stay home for at least 5 days, and you'll need to get them a rapid antigen test on day 6. If that test is negative and your child no longer has symptoms or symptoms have almost entirely resolved, then your child can go back to school. But in reality, we are seeing, a lot of our patients still test positive on day 7, 8, 9, etc. And so if that's the case, then you would still want to keep your child home from school until their negative test. Well, I also get a question, what if my child is still testing positive on day 10 and they're not having any symptoms anymore? So if they're not having any symptoms anymore, there is a very, very small chance that they could still test positive on day 10. And in that case, your child would be able to go back to school, but always make sure to check in with your pediatrician as well for their recommendations. So in closing, we want you to always make sure to pay attention to your child and their body. If they're feeling tired, if they're having symptoms, even if it's not just a fever, if it's that sore throat, that stuffy nose, etc., go ahead and get them COVID tested. It's okay. Even though our rates are going down, we are still seeing COVID in our community. So we want you and your child to be very safe, and talk to your pediatricians. That's our job. That's what we're here for. We're here to listen to you. We're here to answer all your questions. I know all of this can be super confusing with the testing, what test to get, when to test your child. So contact your child's pediatrician and we'd be more than happy to help them. Thank you so much.